I'm James Liadis. I'm one of the pain physicians here at Shepherd Center. Went to the University of Michigan for undergrad and I studied neuroscience there. And then I went to Ohio State for med school. Went on to do physical medicine and rehab for my residency training, and then did fellowship training at the University of Virginia for pain management. Shepherd Center has a great name and great reputation, and I was really excited about the opportunity to join the team here. I primarily work in the outpatient department, so most of what I do is seeing patients that have chronic pain issues. I help them from the standpoint of medications or procedures that we can be helpful with. We're able to do all of those things. Also in the pain center, we have the opportunity to get them connected with our physical therapist that works there and help them get back to activities that they want to be able to do. My philosophy for medicine is kind of trying to understand the patient first, getting as much history as I can, and utilizing that to try and drive what would be most helpful for them. So I don't think there's kind of a cookie cutter approach to any patient, but to kind of think about how the issues that they're having affect them and how you can find unique solutions for that specific patient. Shepherd Center does a very good job of having a team-based approach. So having everyone on the same page of trying to put the patients first, I think is a major opportunity. And then having the resources to be able to give the patients everything that they need to try and get them back on their way to doing things that they want to do, I think is probably the biggest thing that sets Shepherd Center apart. I'd say probably the best piece of advice I could give to a patient is that we often see patients who think that they've tried everything, and there's often, it may be that there have been a few things that have been missed, and so not to give up hope and, continue to try and see if they can find someone that can help them. One of those moments where I felt like I really realized this is why I wanted to be doing what I was doing. I had a patient who was having a very challenging time sitting in their wheelchair, so they had to be laying down because they're having so much sacral pain. That patient we were able to help, and he called us to let us know that he was able to sit in his chair for the entirety of his daughter's wedding. And for me, that was one of those moments where you feel like you really made a big difference and helped someone get through what they needed to have happen.